So what investigations need to be done in the jaundice babies? So for babies receiving phototherapy, measure the hemoglobin concentration, hematocrit and complete blood count to assess for the presence of anemia and to look for baseline in case of severe anemia developing. Evaluate the underlying causes of hyperbilirubinemia. The infants who require phototherapy by obtaining a direct Coombs test in the infants whose mother had a positive antibody screen or where it is unknown, or whether the mother is blood group O regardless of the RH status. So G6PD should also be measured in any infant with jaundice of unknown cause where the bilirubin increases despite intensive phototherapy, where the bilirubin increases suddenly or increases after an initial decline, or who requires escalation. So any atypical presentation, you should consider G6PD, and if there is a family history as well. Remember that G6PD is an X-linked recessive condition and boys are more severely affected. I discussed earlier about the G6PD in the newborn screening. So if you are sending it and you get the results by 3 to 4 days, you don't need to repeat a lab test. Of course, if you are strongly suspecting the G6PD and it comes normal, you may consider repeating it after 3 months because the young RBCs tend to have more of the enzyme.